Hello everyone. Hello Suprat. Always good to see you. Let me know if you have any question. We just have one more session to go, and then we'll be completing 12 sessions. And I'm hoping that you have watched all of them, and I'm sure it will help you in your home state, Odisha. Hi Tasneem, thank you so much for being wonderful TA and handling all this lot of scripts and putting outlines and putting all these questions together. Thank you so much. Okay, so we have the first question from Subrat. He says, if a mother has first baby whose age is 17 months, after that mother delivered a newborn baby. So in this case, mother can breastfeed both the babies? Yes, absolutely, Subrat. This is called tandem breastfeeding, where she continues to breastfeed both older one as well as the younger one. What I do recommend is to keep one breast for each child. Okay, so I recommend that. So the reason being that each baby gets fore milk as well as hind milk. Okay, so keep one breast for one baby and another breast for another older child. So that way, and as we know, it's demand and supply. So breast milk will increase, as it gets emptied. So absolutely, Subrat, just tell mother to continue breastfeeding 17-month-old as long as she can. Okay, 2 years minimum, but it would be definitely recommended to give it even longer, as long as baby wants and as long as mother would like to give. Any other question? If you have, go ahead and ask me. We did finish breastfeeding tutorials and also on complementary feeding. You guys have probably watched, pregnancy nutrition also. Very important also on, to kind of see, what mothers need during, pre-pregnancy period, also pregnancy period, and also lactating period. maybe in my next you know session, in a sense, probably when the next course comes out, we will also add adolescent nutrition in detail. This time I did not discuss too much about adolescent nutrition because the course was on maternal, infant, young child nutrition. But I'll surely add that component in my next semester. Looks like this time people don't have too many questions, which is good, or which is probably, I don't know, not good. uh, but most of our tutorials are quite self-explanatory. Okay. Why should we not add salt to baby's diet until 1 year of age? So baby's kidneys are not mature enough to handle that salt. Plus, mother's milk has sodium, as well as food that you start from 6 months of age. A lot of these foods have natural sodium in it. So up to 1 year of age, we don't recommend sodium. After 1 year of age, you can add salt to just a little bit, whatever that you use in your food. You can use. I definitely recommend not to give salty snacks, to young ones. I do see young toddlers eating a lot of chips and a lot of those fried snack which are very salty. So that is absolutely no at any age. But just salt in regular food that you cook at home after 1 year of age is absolutely fine. I couldn't complete assignment 4 and 5. Any chance to complete the same? So, if you don't complete the assignment in time, then nothing to worry about, because only 8 out of 12 are considered. Okay. So make sure that now you complete your whatever remaining assignment, and those session assignment number 4 and 5 will not be counted. Okay. Is it required to burp a newborn baby when baby breastfeed only colostrum? See, what happens is initially baby still learning to latch. Okay. So whenever baby has a nipple latch, a lot of air goes into the mouth, because that the seal is not very good in nipple latching. Okay. So I personally do recommend, if you breastfed from one side, to put the baby in a sitting position, because that serves two purposes. One purpose is that if baby has swallowed any gas, we will basically remove that gas. Second purpose for me, which is more important, is waking up the baby. So as soon as you put the baby in a sitting position, most of these babies, they wake up. They open their eyes and then they are ready to feed again. Okay. So for me, I think that's a bigger purpose of putting baby in a sitting position, in a burping position. That's my favorite position. So I do recommend, if from beginning, to keep the baby in a sitting position once baby is done on one side or even has delatched. In most of the complementary recipes shown in the tutorial, do not add ghee. So when should we start ghee and how much per day? Okay, yes, Anshu, you can start adding ghee immediately. You don't have to wait. The reason probably we have not put ghee is basically because we do recommend egg to begin with, in children's diet from 6 months of age. And egg do provide cholesterol and other good fats. But yes, if you're vegetarian, then absolutely you can add half a teaspoon or maybe quarter teaspoon of ghee. You don't want to put too much of ghee, because that will fill up baby's stomach, and I want baby to get a lot more protein. So I want the baby to have good appetite, to have nutrient dense variety of food, and we don't fill up baby's stomach just by fat. So you can add say quarter teaspoon of ghee, probably to every time the child you make anything, you can put a little bit of ghee in it. There is no issue at all. Do we need to refer any other books for our exams? No, Swapnaja. I think just all these multiple choice questions are actually very very easy, and they're all from our my sessions and all the tutorials that you have watched. So you don't have to take any other. This is a very easy exam, so do not worry too much about exams at all. This is all very much concept based, so you'll do fine. Please explain complementary feeding for preterm child. So what we recommend for preterm children, that complementary feeding should be started at the end of 6 months. Okay, you don't have to kind of go back to 2 months previous just because baby was born at 7 months or 8 months. You basically start counting from the time the child is born, and immediately after 6th month completion, you can start complementary feeding as you're giving it to normal, appropriately gestational age babies. So there is no separate complementary feeding for preterm child. Okay, you start with pureed food just like how I've mentioned for regular children, and then around 7.5 to 8 months you can start with little bit of chunky food so that child learn to eat. But yeah, there is no special complementary feeding for preterm versus regularly born child. Question from Sudepti. What about mother's nutrition during different phases of child's development, like pre-delivery, post-delivery, lactation, and weaning? So we don't use the word weaning. We use the word complementary feeding. Weaning means something is going down and something is increasing in size. So weaning was used few years ago. So weaning meant that you decrease the amount of breastfeeding, breast milk intake, and increase the amount of complementary food. So now we don't recommend to use at weaning. We are not weaning the child from breastfeeding. Child is continuing breastfeeding. What we are doing, we are basically adding complementary foods at the end of 6 months to get that calories and nutrition going. Because after 6 months, children do require a lot more nutrients in the diet, including calories. What about mother's nutrition? Mother's nutrition main focus is absolutely basically all your type 1 and type 2 nutrients. Focus on protein, because what I've experienced in Indian setting, that protein requirement is really really low in our mothers and even children about 6 months of age. So just do focus on protein, and I think will be fine. And protein rich foods are also high on other type 2 nutrients. Some of these protein rich foods are high on bioavailable iron, bioavailable zinc, B12. So all this I would recommend to focus on more on protein and nutrients which are kind of not which are lacking in mothers, which is of course your iron and your B12, choline. These are some of the nutrients which are lacking in Indian diet. So focus on food which will give a lot of those nutrients. Uh, I won't be able to give my exams this time, even though I have registered for it. I had fallen and broken my back. That's fine. I think Mona, what we may do is that this course will be offered again probably next year in January. Okay, so just keep kind of just write to NPTEL and they'll contact you when this course go live again. Uh, Instead of sprouts powder, can we give freshly prepared? Of course, Kiran. I mean, freshly prepared is definitely much better. But the reason we have prepared powder, because a lot of time what happens is mothers, they give khichdi a lot in India. So they give this rice and dal khichdi. So what we have done, we have created these powders which mother can store for a week or so, and then she can basically, while she's preparing this khichdi, while she's cooking it, she can add this powder, which this powders, sprouts have a lot more nutrients, okay, and that would including fiber. So that way she can just it's all ready. It's like lot of mothers, they buy Cerelac from shops, and Cerelacs are loaded with sugar and it's loaded with probably preservatives. So here what we have done is we have asked mothers to prepare these powders at home, of course without any preservatives, but it will give extra nutrients to children's khichdi. Because khichdi is such a staple diet, and I've seen that everywhere, any state you go, most of these babies, they get this khichdi, in a sense, rice and in some kind of dal. So either it is in rice dal form or they're into khichdi form. Okay, so that's why we prepared a lot of this nutrient dense powders that you can just add while cooking. But yes, if you have time, definitely fresh sprouts, absolutely is amazing. That's really great. When would be the exam, ma'am? Any change in the date? No, I think it's on 24th, if I'm not mistaken, 23rd and 24th. You can just write to us, and probably Tasneem would know what dates. But I think it's on 24th April. If you will start some new course, please do notify us. Yes, Anshu, I think my focus is so much on maternal infant young child nutrition, so I will continue to give the same topic. Maybe later I may take some course on early childhood development, but at this point my focus is really maternal infant young child nutrition, because what I'm seeing in India, it's not only poor children are not nourished well, but even privileged children are not getting the nutrients that they require to grow healthy. Because I'm seeing too many children putting on too much of weight rather than height. So the BMI is rising, as you can look at CNNS data or NFHS5 data. So I really want to focus on just one aspect of nutrition for mothers and children. Okay. Is it recommended to start with iron supplements before 6 months of age, even though the baby is feeding well and gaining adequate weight? So, in US we used to start iron supplements at 4 months of age. Okay, but what I feel is if mother is taking iron supplements and if she's eating food which is good, high in iron, if she's not anemic, then our children will not be anemic. So definitely I don't recommend as much to start iron supplements before 6 months of age. But after 6 months of age, again, if you're giving food which is high in heme iron, those children may not need iron supplements. So if you're non-veg, do think of giving foods which are high in heme iron. Egg is one excellent food that you can give that will definitely help with iron deficiency. A lot of beans are high in iron. Of course, it has a lot of anti-nutrients, so you have to kind of work on processing those beans, soaking, sprouting, cooking, so that will decrease anti-nutrients. Avoid adding with food which are high in your phytic acid, so oxalates. So just focus on food-based iron rather than supplements, because iron does have a lot of side effects also. I would like to know that in our recipe you are mixing curd with eggs and meat. Is it good? It is first of all, curd does not have any anti-nutrients, so it's lacking in. It doesn't have phytic acids or oxalates, which is good because that's a first-class protein and it will absorb your protein, like pretty much complete protein. It will absorb. The absorbability is pretty good for curd or any dairy product. So I don't have any issue combining curd with any of these meats, because meats are also absolutely lacking in phytates and oxalates. So if you're combining your meats with dairy, in fact I don't see any issue. And if you look at a lot of our recipes, even culturally, we do add a lot of dahi in our meat products. Like for example, when you marinate, a lot of time you marinate it in dahi, right? So I don't see any issue. But Tasneem, she's an expert in nutrition, and Tasneem, if you have any other recommendation, please feel free to reply on this forum. Okay, what complementary feeding can be given to babies who are on the tube feeding? So this, yeah, this is a special case. So of course, I don't go too much into special cases because I don't have experience in dealing with such cases. My experience has been more into community pediatric nutrition, community in a sense more of maternal infant young child nutrition. So I'm not in a state, or I will not be comfortable to answer these questions. But of course, you want to give them food which are high nutrient density. So I would recommend to give maybe more of a paste. Say if you're non-veg, then meat paste, chicken paste. Your probably buttermilk is good. Some of the paste, like vegetable paste are good. So exactly everything that you are giving, by mouth, probably that should be good enough. Into only thing is when you have to make it a little bit more watery, because otherwise it can get blocked. This tube feeding can get blocked. But pretty much, you want to make sure that all the nutrients are kind of taken care of. I would definitely avoid Pediasure, okay? Because if you look at Pediasure, it's highly processed. It's very high in sugar. So if you look at the label, extremely high in sugar, okay, and extremely high on emulsifiers and a lot of those things. So I don't recommend Pediasure at all on when the child is on tube feedings. Okay. Please suggest some recipes for breakfast. Kiran, we have so many recipes, my God. So we have created, some tikkis, we have chillas, which are kind of not too like not too much of starch and too much of carbohydrate. Even tikkis, we have not used potatoes. You don't want to give too much potatoes and any other rice product, because what I'm trying to do is to prevent obesity or overweight in children. So please again watch a lot of this tutorial. Or if child is older, say more than 1 year of age, then they can start eating adult food also. So you can use any of those adult recipes for children. Of course, for young children, that's from 1 to 2 years of age, you want to keep it more soft. But if a child is school going, then you can use any recipes that we have prepared for adult. Why, I don't know why they can't eat those recipes. And we have a lot of in fact, there is one tutorial that we have created is our nutritious snacks for children. So you can make those recipes for, and to be frank, for morning breakfast, egg is the best breakfast that child can have. So if you're eating eggs, then please go ahead and allow that breakfast as eggs recipe. So it could be scrambled egg, or it could be boiled eggs, or it could be omelette. So whatever the child prefers, but you can make different varieties of egg recipes. And and then there are other ways you can try. You can try different kind of tikkis that we have made, like not like aloo tikki, but not, we've not used aloo, of course, because it's against starch. But you can use so many different recipes. On the fourth or fifth day, baby requires 4 spoon meal, 4 tablespoon. Yes, the food made for this once, or after making need to keep it for refrigeration for next 3 meals. No, so you can refrigerate for probably the next meal, but I recommend for next day you prepare fresh food. Nothing like fresh food, because once you store it for a little bit longer, some of the nutrients go down, especially vitamin C and all. So I prefer that you give it as fresh as possible. Yes, one meal you can kind of store it in a refrigerator, but I'll give you some of my experience in US, because in US we had to go back to work within 2 weeks of delivery. We just had 2 weeks of maternity leave, so you can imagine how tough that would have been. But even after 6 months of age, what we would do, and our work hours were very long, sometimes 8 to 12 hours. So what I would do is to basically prepare some of this paste and then put it in the ice cube tray. like you have this ice cream tray. So I would just basically fill it up and then remove one cube, for one meal, or just make sure there are 4 tablespoons of that meal. And it was easy for, my babysitter to give that obviously, it's I wouldn't say it's a substitute for fresh meal, but in such situation, you can do that. You can just put it in a ice cube tray, so you don't have to make it on a daily basis or 2 times or 3 times a day. uh, Curd meat combination can be difficult to digest for some people because of different sources of protein combined, or they can trigger an allergy. That's why we recommend introducing separately first. Yes. So anytime when you're introducing any meat or any kind of protein or any food, you introduce separately. But eventually, then you can mix it. There should not be any problem. So yes, introduction would be separate. There is no doubt. Thank you. Will there be objective or subjective question in exams? I think everybody is very scared of exams, Dr. Rekha, do not worry at all. These exams are very simple and very easy, do not worry at all. These are like really, we have kept it, I want everybody to pass. I don't want anyone to get worried about exams, because that's not the final goal. Exam is not the final goal. My point was to kind of introduce you to this topic of nutrition for mother and children, and also infants, and then you will learn much more when you start practicing in the field. So I'm much more concerned about you trying all the different techniques of breastfeeding, try this different dietary diversity in children, after 6 months of age. Work on protein intake in mothers and lactating mothers. I think for me that is much more important than just clearing your exams and getting that. That you will clear, there is no doubt. But I want that next phase to come in as quickly as possible. When I soaked dry green peas for 8 hours, it were not soft, and if I'm soaking for more hours, peas get spoiled, maybe due to summer. What should I do? Should I proceed further with making powder? So again, Kiran, I think Tasneem will be a better person to answer this question. But what I do recommend is to, when you soak it, you try to wash more frequently, while you're soaking it. So do that. And this is dry green peas. Okay. What I do generally, I don't use dry green peas. What I do is I kind of freeze green peas and then use those frozen green peas and then defrost it. So I think that would be a better way. But dry green peas powder would be difficult. I don't think we have shown the dry green peas powder so far. So I don't know like how the processing would take place. Maybe Tasneem can answer this question. But I prefer that if you're going to give green peas to babies, then I rather that you defrost the fresh green peas which are frozen, and then basically cook it and then just make a paste out of it. I think that would be much better than using the dry green peas to make powders. Okay, fruit combination for 8 months. Kiran, I'm not like, okay, you want to introduce child to fruit, but don't go overboard with that fruits, because you don't want children to get used to that so much of sweet taste. You can give maybe once a day some seasonal fruit, in a small quantity, but maybe after the meal. Okay, try to avoid giving fruit by itself in between food or in between meals, because again, it is fructose, so I'm trying to avoid giving too much of fructose, or of course other sugars also, the sucrose and all that. But just be careful, and do not try to mix that fruit with any other complementary foods. Just give fruit as a dessert, and dessert we don't have it with each meal, right? Do we have desserts every meal? No. So give one fruit a day, if it's small child, then just we could just give a half of it or maybe quarter, and then give it more as a dessert. Because again, I'm just, and I see a lot of cases who do get kind of sweet taste, and then they refuse a lot of other food. So you don't want to develop that sweet taste for children, because then they'll prefer sweet in everything. Okay. Any other questions? Anything else? Let me know. I do recommend actually, eggs. So make sure that we kind of, even though if we are vegetarian, if its religion is not too much of a concern, that one egg a day will really do good to children's health as well as height. Because there are many studies which are published, and they have shown, and especially in Guatemala and a lot of this, South American countries, that egg has definitely improved children's height. So do think of giving eggs, and once child is a little bit older, then you can give 2 eggs a day. There should not be any problem. Okay, so just make a habit that like breakfast should be eggs, and then try not to include bread or toast or any of those high carbohydrate food with eggs. Eggs by itself with dairy is absolutely okay. You can put some sauteed vegetables on the side, so the children can get some potassium. Say for example, tomatoes, sauteed tomatoes. So you can put some sauteed tomatoes, some sauteed spinach, so children can get some magnesium and potassium from spinach. But I prefer that we make it a routine of just eggs for breakfast. It will really help them in school time also, because I do see so many children getting kind of Kellogg's and General Mills cereals, and I'm kind of a little bit concerned of a lot of this sugar-rich breakfast, because it will dip their sugar after a couple of hours, when the insulin rises in the body. So, and that's not good. It will cause a lot of attention problem. So give food which does not increases the insulin level too much. Okay, and that would be your protein and good fats. Okay, can you please, Anshu, okay, I'm going to read your question. Can you please suggest some NGOs who are working maternal infant young child nutrition where I can apply? Yes, of course. I will do send this question on on our questionnaire, or like there is this session where you can ask a lot of questions, not on live but on our website, and we will try to compile that and send it to you, Anshu. Okay. Can we include semolina? You can include semolina, but Kiran, again, I'm seeing a lot of children with the gluten sensitivity. So I personally do not recommend wheat to children. I mean, personally, this is my personal opinion. Not everybody may agree, but I do see there are a lot of other grains that you can use, millets that you can use. So you can use ragi, you can use little millet or kodo millet or bajra, jawar. So I prefer that we use those millets, and then semolina, because semolina is basically wheat. How many times 8-month-old baby breastfeed? Good question. So what I recommend is, first you feed child complementary food. So 8-month baby would be feeding about 4 times. 6 months is 2 times. 7 months 3. So yeah, so about 4 times a day child will be eating food. So during those 4 times, let child eat first, and then you can breastfeed after some time. And in between, if child is hungry, you can breastfeed the baby. Again, it all depends upon child's demand, because sometimes what happens when child is growing in length, and when they do have more appetite. So you go by child's appetite, hunger cue, do more a responsive feeding rather than be very regimental that no, this is the time that I want to breastfeed, this is the time, yes, you can regularize timing, but again, go with the flow, you know. Uh, yes, older children I do recommend to breastfeed more at night so that daytime they eat more, but toddlers they do need breastfeeding at night also. Okay, so I think up to 6 to 7 times of breastfeeding should be okay for 8-month-old babies because they have very good sucking power. So even if they feed for like say 7 minutes, 10 minutes, they completely empty the breast. So they have that capacity of getting much more milk in one go. So you don't have to feed them like how you were feeding these children when they were born. Okay, it's not 12 times, it's probably 6 to 7 or maybe sometime 8 times, but it's not definitely every 2 hours or so. But Kiran, I'm so glad you have so many questions. I'm really happy that you're enjoying this course and you have all these questions. So great. Do pass on these important messages to everybody you know. Do tell all your WhatsApp groups about this important information about correct technique of latching, correct technique of holds, so many different counseling points, because it does make a difference, in child's life. Another thing what I've experienced, I just want to share some of those experiences, as I'm getting more and more questions. Uh, I was in one of the district recently and I did see, I visited district hospital over there and I saw that a lot of these mothers who had cesarean sections, they were not taught proper breastfeeding techniques. And by the time I visited those babies, they were a little bit kind of low on sugars. In a sense, they had poor sucking, they were drowsy, they were not, like they had tremors. So what I had to do is to immediately ask mothers to manually express milk. Like I had to teach all of them press, compress, release. Get that milk in the spoon and feed to children. As soon as they fed 2 or 3 teaspoons of that colostrum, they were so alert and active, and then they started latching again. So that's a new learning that I had, that because I worked in community for all these years after coming back from US. In US, we are very, very strict. If your child is born small or and in this district hospital, most of the babies were born small. We would immediately check blood glucose level. But I feel that please explain to mothers during pregnancy itself to learn how to manually express, and if they go through C-section, they can start expressing some colostrum, and if they, at least, of course, latch them directly. There is no doubt about it. But if baby is kind of drowsy and very difficult to latch the baby, or if mother is having too much of pain, tell her to just basically start expressing with hand. No pump, please. No using pump or no nipple shield, and that will help baby for sure. But goal is to teach babies latching as soon as possible. Okay. Thank you, Kiran. Thank you so much. Uh, Rupal, Dr. Asha, herein breastfeeding is not frequent. What about Phil? Yes, yes. Hi, Asha ma'am. Thank you so much for joining. Thank you so much. Yes, so if breastfeeding is not frequent, what I do recommend is to manually express, and feed or just store the milk in the fridge, and you can feed after, suppose baby wakes up and do latching, and then you can just feed that extra milk, but I do recommend to express milk, because if mothers are not feeding breastfeeding frequently, or if babies for some reason are not taking, for say if they're sick or if there is anything, or if mother is away, then the milk supply will go down. So I do recommend that a mother should manually express and at least store it. We have a beautiful tutorial on how to store this milk. Uh, just watch it again. She can keep that stored milk out in a cool temperature, outside in the room temperature for 4 to 6 hours. Okay, but I feel that try not to kind of keep that milk in the breast for too long, because then that will decrease your breast milk supply. Okay, thank you so much, Asha ma'am. You are my mentor. So thank you for being here, and thank you, and happy birthday to you. So happy you're here. In laid back position without using the finger position dependent, can baby open in a laid back? Yes. So you know what happens, Subrat? In a laid back position, when you're putting the baby on the mother, okay, so laid back is pretty, it's almost more like almost like a lying down position. Baby's mother is little bit kind of in a little bit in a kind of reclining position, right? So in that position gravity helps. So when the baby is towards the gravity, what happens, baby can open the mouth widely and the tongue will fall out. Okay, so when the tongue falls out, automatically baby will have a beautiful attachment with a deep with a big mouth open. Now it's up to 120 degree, so do try that. So in fact, in mothers who have cesarean section, who can't even move sideways, we put the baby on the breast with legs on other breast, all a little bit slanted, and we don't need to hold the breast or anything. Yeah, sometimes we may need to hold if baby is not latching on properly, but 90% of the time, they do basically kind of because the gravity helps. So when the baby is towards the gravity, then there is no issue of opening the mouth. They open it very beautifully. So that's a good question that you asked, Subrat. Uh, do you guys do any hands-on breastfeeding training? Yes, Dr. Rekha, I do it all the time when we do face-to-face training. What you can do is maybe you can write an email, and if you're whenever you visit Mumbai, I can take you to our nutrition clinics and slums of Mumbai, or we can take you to any of these urban healthcare centers, and I can show you. But unfortunately, it's very difficult to do it on NPTEL course because it's more of an online course. But I'll be more than happy to teach you hands-on breastfeeding training if you visit in Mumbai. Let me know. My child is preterm, ma'am, and I have gone through a very tough time, but you have helped me a lot. Oh, thank you so much, Kiran. Thank you so much. I really appreciate your comment. Uh, uh, Okay, could contain casein. So after 6 months or so, babies, they do okay, because obviously breastfed babies, they do have good amount of whey protein in breast milk. But after 6 months, I think it's important to start, especially for vegetarian children. I do recommend to start complete protein. Okay, so if a child is vegetarian, if child is eating say only dairy product, then curd is the must, because it has shown to increase height in children. So absolutely it is okay. A little bit of casein in curd is absolutely fine. There's no issue. In fact, curd has all good bacteria, so that will improve children's gut microbiome also. So yes, you can use curds. Absolutely. I don't recommend using dairy milk because children are still on mother's milk. So I don't like to tell mothers to give dairy milk, because that will replace mother's milk. So dairy milk is totally no for children. Okay. If mother is not giving breast milk for some reason, then I prefer dairy milk to formula milk. So I tell mothers to not use, you do not need to buy formulas. Just give dairy milk. You don't need to dilute it. You don't need to do anything else. It's just give regular plain dairy milk. But otherwise, if babies are breastfeeding, then only mother's milk, and then once you start complementary feeding after 6 months, you can give curd, which is amazing type, your complete protein. You say 8 months old baby. No, they don't necessarily feed more at night, but I do recommend to kind of feed baby more at night. They don't. It's not necessary that they do feed more at night. But what happens once you start solid food? I prefer the children eat more of solid food during daytime, because what happens is then these children, they don't, because what happens, you must be knowing this, or in India we have this issue all over. When mothers start breastfeeding, all Anganwadi workers and Asha says, ma'am, but these children, they keep drinking breast milk, they don't want to eat anything. So here what we have come up with, this solution is, okay, try to give breast milk more at night, but during daytime give solid food first, then after, to quench the thirst, just give breast milk. Of course you can give some amount of water also after 6 months of age, but breast milk comes more as a quench thirst. It quenches the thirst. It gives so much of this good protein and so many other nutrients, everything. So rather than just giving breast milk all the time during daytime, at 8 or 9 months of age, I prefer that we focus more on solids. Give breast milk, after food, but do give breast milk at night, because children who get a lot more breast milk, they will definitely grow well. And with this special technique of cross-cradle hold and all this counseling, the children will definitely become 9 kgs. We have seen in our program, and even now we have the state level WhatsApp group, and children are growing leaps and bounds. They are like 6.5, 7 kg by the time they are 3 months old. So you can imagine what they would be at 6 months of age, right? But you want to continue make them grow after 6 months, because if you don't work on their nutrition after 6 months of age, and if mothers keep giving just breast milk and nothing else, what happens then, they become malnourished. Malnourished means they already tall, but if you're not sustaining the weight for that height, then they will start becoming moderately acutely malnourished or severely acutely malnourished. So you don't want that malnutrition sets in just because of the poor complementary feeding. Okay, so here I'm trying to explain the balance of complementary feeding with your breast milk. So you don't want to decrease the breast milk. You continue breast milk, you're just adding your complementary food because of the extra requirement of nutrients, after 6 months of age. Okay. Okay. I prefer masala dabba technique instead of ice cube. Yes, of course, Pratna. Whatever, just throw out all this, whatever amazing things that you can. Oh, Pratna, this is. I don't know why, Asha ma'am, your name comes with Pratna. Yes, absolutely. That's very Indian way of doing it. So perfect. I love that. Will we continue to have access to study material even after the exam day? Yes, of course. You can access our study material. It will be there on NPTEL's site forever. We have it on YouTube also, so you can also download those videos. And you can, in fact, download our sessions from NPTEL site also. Okay. Laiba, ma'am, do you offer any internship at your nutrition center? Yes, of course. We have a couple of centers now. We have it at Srirampur in Maharashtra. We have it also at Mumbai. What we can do, I also work with a lot of governments. So we can also try to kind of give you internship in any of those areas also. So yeah, let us know where exactly are you located and where you're interested. My mothers and lactation helpline are doing very well with cross-cradle. Thank you, Asha ma'am. I love you so much. Thank you so much. I think what we need to do is to really kind of teach other, pediatricians and nurses and lactation consultant, because they are using nipple shields a lot. And I really need your help, Asha ma'am, because most of these cases I get, they are from Bangalore. So I don't know, you have to help me to kind of do this disruption of our counseling techniques. So wish we could get printed recipes. So yes, Asha ma'am, we have scripts written, and what I will tell my team members to kind of give you access to the scripts, so you can just basically make printout and keep those. And another thing what we are also doing is we are also making the transcripts for all our tutorials and our session. So I'm sure NPTEL will put up those transcripts which you will be able to download or do print out from NPTEL's site. We'll be able to refer this channel after this exams. Yes, absolutely, you'll be able to refer to this all the sessions. To whom should I contact for any exam queries? You can write to us. You can just write to us, and I'll be more than happy to answer any of your questions. Your message is at 8 months give breast milk after. Yes, I do, because you know what I've noticed, Asha ma'am, because for past 15 years or so we have monitored almost 10,000 babies on IYCF, and what I've experienced is that if babies were breastfed earlier, like then complementary feeding, they were just not they were not accepting lot of different taste and lot of different, they were just getting filled up with breast milk. So it was difficult for us to introduce, because we are still running clinics where we do a lot of cooking demonstration in our clinic with all these mothers coming in. So we have noticed that babies who are already fed breast milk and they came to our cooking demos, those children were not accepting a lot of these foods that we were giving. So that's when we started recommending mothers to try, because they're trying all the different new tastes, different recipes, different textures, different all these different smells. So if when they're hungry, just like us, right, Asha ma'am, when you're hungry, you will eat everything and anything, and if you're full, even if you have just like the best food on the planet in front of us, if we're full, we won't enjoy it as much. So that's the same concept that I saw in children also, and I feel children are just so smart. uh, Ashame will be providing transcript which will have written recipes and some pictures. So thank you, Tasneem. Thank you so much. Complementary feeding, yes, complementary feeding also. So we will have recipes for complementary feeding also. Ms. Spark at Nutri, you can refer to our YouTube channel with the name Health Spoken to IIT Bombay. Yes, so we have all these tutorials available on our YouTube channel, and you'll be able to access any of those tutorials. NPTEL has some of my live sessions also, so you can access those live sessions also on YouTube actually. I'm willing to take students with internship. Oh, thank you, Asha ma'am. Thank you so much. What we can do, Asha ma'am, do like when you give us a permission, we will kind of share your contact detail with any of this participant who took our MIYCF course, and they would be very happy to join you, because they have so much to learn from you. You are just so humble to take this course, but you know much more than me, to be frank. So I really appreciate your help. Larry, do you offer any hands-on training program in Telangana, Hyderabad specifically? Thank you. So Larry, I don't know any pediatrician who has taken the course in Hyderabad, the Telangana area, but I have Asha ma'am, and she is from Bangalore. So if you want, you can contact her, and maybe you can connect with her, and we can. And if you're coming to Mumbai, then you can have internship, or you can. We have our clinic in Srirampur, where we have beautiful clinics going on in nearby villages. So, and we have a facility to stay there, so you can stay there for 2 weeks, 3 weeks, and we can you can do internship with us in that Srirampur. It's a village area, but we have excellent facilities to stay. Okay. Truly want to help with the breastfeeding machine. Yes, Asha ma'am, we need that, because as there are a lot of wasted interest, and we have to fight this wasted interest, and there are very few people like you who genuinely kind of want to work, on objectives which really matters a lot And for any mother, any child, as you know, those first 1,000 days are just so important. And I really kind of, I know that you also wish that mothers have a very successful journey without going through a lot of aches and pains. So I'm so grateful that you're with us. uh, okay. uh, Thank you. Thank you, Asha ma'am. Thank you so much. I'm doing my master's in nutrition and dietetics. I live in Dehradun. So if you have any internship in this regard, so in Dehradun, actually, Laipa, I am coming to Uttarakhand. There is a nursing college in Bhimtal. Okay. So I will be coming to Bhimtal for 2-3 days for workshop. So get in touch with me, and we can coordinate. You can come there because I'll be taking all these nursing students and faculty to district hospital for hands-on training. uh, Hello ma'am, is there any relation to access sweets and dairy products in early childhood to developing ADHD? Yes, sweets for sure. Dairy products, we still kind of, I still need to go deep into dairy products and ADHD research, because I've not gone into that behavior and developmental aspect of ADHD and nutrition so much. But for sure, I know that excessive sweets does cause problems in attention of the children. Okay, so I definitely don't recommend sugar or jaggery under 2 years of age. But even about 2 years of age, as you know that we are struggling with overweight and obesity in our children in India. The rate at which children are becoming pre-diabetic and overweight obese is much faster than children coming out of undernutrition. So please remember that the time will come, as I told you in my last session, that in Gujarat, state of Gujarat, 20% children between 5 to 9 years of age are pre-diabetic. So please consider this. It's an epidemic, and do not kind of unnecessarily give sweets to children. Maybe on an occasion once or twice a month is okay, but you want to inculcate good habits in the children. Okay. Okay. Thank you, Asha ma'am, for arranging and thinking about this, internship. I think we can do this because we want to pass on this knowledge to as many young students as much as possible. Mona, please make provision for online internship also if possible. I live in Mohali and also run an NGO. Okay, so yes, we can do that, Mona. Let me think of how we can do online internship. Maybe I need to think more about what kind of online work that we can do as part of an intern. See, if my department in Sitara, IIT Bombay, we deal with a lot of data. Okay, so we get a lot of data from government, different districts, different states, and we do a lot of data analysis. So we for those kind of work we can do online internship. But if you want to actually kind of do grassroots level work, then it's important to be in that area and to be working with mothers, children, to be working with people working in NGOs. Okay, so I think that the online internship would be kind of difficult in our scenarios. Uh, Larry, I'll definitely contact you or Asha ma'am regarding the short internship. Thank you so much. Anshu, I'm in Bangalore. How can I contact Asha ma'am for internship? Okay, Asha ma'am, you already are developing fans. Okay, so please get them under your wings and guide them, because this is the beginning, and as we kind of spread this awareness about maternal nutrition, infant nutrition, you will get more and more students under you, and you love to teach. I know that. So this is amazing. Uh, any hands-on training in Ahmedabad? Yes, yes, Kiran, we have Dr. Prachi, and she has been following our cross-cradle hold and other important kind of nutrition advice for a long time. So if you need her help, let me know. I will connect you with her. Also, Kiran, I'm coming to Ahmedabad in last week of April because I have a training with Ahmedabad Municipal Corporation, and we will be doing hands-on training over there also. So, Kiran, just send me an email and I'll send you more information. Okay, we can definitely do hands-on training in Ahmedabad because I visit Ahmedabad very often. Do you have any research opportunity in Bangalore? Yes. Now, since Asha ma'am is on the board, she will definitely give you a lot of research opportunities. We can do a lot of, in fact, I must give you this very happy news that one of our students is presenting our research, data analysis that we had conducted in Banaskantha, Gujarat. We did 9 month study where we basically brought all these pregnant mothers to our, in fact, I have already discussed this in session 1. And when we saw results at 3 months and 6 months, so he's presenting data of all the children whose mother watched our tutorials, especially cross-cradle and latching. So we compared it with control and experimental group, and what we found that children who were kind of taught cross-cradle hold, malnutrition rate was much lower. Okay, so children who were given kind of other techniques, the undernutrition rate was 3 times higher, and that his abstract is kind of accepted, and out of 4,000 students, only three students abstract got accepted as poster for for that place. So, and he's been sponsored by global forum in Geneva, so he's going to Geneva. So that's the good news, and we can create a lot more studies like this, and we can present to Geneva or even Oxford, because this would be more of implementation research, and they are looking for implementation research, how we should bring about changes in government system so you can see changes. Okay. Rupal, I came to seek my mother's house for her blessing. I didn't want to miss your session. I'm in love with this excellent course despite having more than 8 degrees. Asha ma'am, you're my guru. Thank you so much. Like, I feel so privileged for you to be on this course. Thank you so much, but we have to work much more now. We have all these degrees, but now we want to make sure that we have now many more mothers who are being helped. So NPTEL also gives internship to toppers of the course, ma'am. Thank you, Bharti. Thank you so much. You've been so supportive and so patient. Bharti, for everybody, Bharti has been our coordinator at NPTEL, and she made sure that we had all this sessions ready. We had scripts, kind of outline ready, and questionnaires ready, and assessment ready. Bharti, I love you so much. Thank you for being on top of this. We just have one more session to go, and then hopefully from next semester we will take this course in Hindi, because we have a lot of Hindi speaking people who have requested this. So let's see if I can do that. Okay, we are doing a study on cross-cradle and conventional techniques. Okay, thank you so much, Asha ma'am. Let me know how it goes, and if you need any of the support, let me know. Please give details of Dr. Prachi in Ahmedabad. Kiran, please email it to me. You can post the question on that, on our NPTEL course, and I will send you. Okay. When burping a newborn from first or second day in sitting position, in this time, neck position is not controlled. More fear come here that the baby may suffer any fracture. What's your suggestion? Okay. No, Subrat, I would not worry at all, because what you're doing, when you're putting the baby in a sitting position, you're holding baby's jawline, okay, and your wrist, the chest of baby is supported by the wrist, okay, so you're doing like this, and your other hand is holding baby's back. So there is no issue. In fact, in our centers in US, we even make 500 gram babies sit. in a sitting position. So I would not worry at all about any damage being done, or any back problem or nothing. You're holding the baby, you're supporting the neck, you're holding it tight. So make sure that you teach mothers on baby doll first, and then you can teach. Okay, nothing to worry about it. So I think we have already crossed, oh my god, it's almost more than an hour. So I'm going to end this session now. Thank you so much, everyone, for joining the session and asking so many important questions. I will now basically finish my session, last session. It's going to be on growth charts, anthropometric measurements. I will also include some of the tutorials which just got released, so that you can use it in your practice if the need be. And I will also discuss, I will just do one live session, like live recording on concluding remarks of the whole NPTEL course that we went through. Okay, so thank you so much, and I really again appreciate all your time, your energy, everything, and thank you so much.